Okay, we're gonna move on to the rest of the hospital. They're in dental right now, so it'll be a little bit of a mess in the back, but you'll get the idea. So walking into the hall here, we have lab. So we have all of our vet lab station machines and then our pharmacy here. So pharmacy is on both sides. We also have our flow board, cameras for the front. This is where all the prevention lives. So Bravecto, Simparica Trio, our dog products here. We've got our cat products on this side. Revolution Plus. We're waiting for an order to come in, so everything's pretty empty. Bravecto, Revolution Plus is definitely the preferred prevention, as is Simparica Trio. Bravecto tends to be less effective here. All of our skin products on this side. Skin and ear products live on this side, topicals. And then we have all of our nutraceutical type deals over here. Proviable. This is Dr. Susan's desk. This is my desk here. It's a mess right now. And all vaccines, clips, things like that. Moving on, this is where all the condolence cards sit, waiting for signatures. And then we're on to the treatment room. Emily, Dr. Susan, Lily, Ella. And this is a treatment room where most things happen. So as you can see, we have really limited kennel space in here, which is why we ask for a lot of owners to stay and not drop off their pet, because we only have room for 2 large dogs. It's a really small space. It's a small hospital, so if we have any unruly dogs, having them sit with their owners while they're here is often our preference. From here, we have X-ray. So X-ray and ultrasound are right over here in this section. And then we have dental and surgery. So dental's a mess right now. They just pulled a patient out of here. As you can see, it's a really tight space, which is usually a lot cleaner than this, but this is the dental area. And then we have into surgery, again, a small space. We do have 2 anesthesia machines, and that's pretty much it in our surgery space. One last thing that we have is our outside fenced area. Because we're a fear-free hospital, we often try to figure out the space that works best for patients when they come. So our high FAS patients oftentimes are more comfortable in this backyard area. So you'll hear in rounds when we're going over the appointments for the day, sometimes we'll say, oh, this pet maybe should be offered a visit in the backyard. Euthanasias are another appointment type that often wants to be set up back here. We set up a blanket and try to make it a nice, peaceful experience for owners who are euthanizing and they choose to be outside. One important note for being in the outside space is that the clinic cat Kika is often out here. So when we're using the outdoor space for higher FAS dogs, we need to make sure that it's clear before we let the owners come in. So when owners are coming and having a backyard appointment, we always want to have them check in when they arrive. You can let them know that they can hang out outside by the fence, but don't enter until we come to get them. We will always escort them into the fenced area. We don't want them to enter on their own. And then if owners are picking up medications after hours, we sometimes leave medications out if they've been paid, but owners can't come to pick them up. It's important to share with owners, once medications are left out, we don't accept responsibility, so it's kind of at their own risk if they want us to leave them, but they would be left in this little bin right here, is where we would leave medications that have been paid for that owners are picking up when we're closed. So that's our hospital tour.